Hello, Seagulls. Thank you for joining us for today's briefing. Today I'll be joined by Victoria Lentz, Vicki Lentz, the Director of our Student Health Services and a member of the University Health Team. Next week is final exam week, and I know that all of our students are studying hard so you can finish the semester really strong. As you study and prepare for exams, I want to encourage you to take some time to decompress and focus on your mental health. It's really important. We're all very frazzled at this point in the semester, and we all need a break. So take care of yourselves. Don't get overly stressed, and please trust in your ability to do well based on all the hard work that you put in this semester. Now, some of you are graduating this month, and I want to congratulate you on that exciting event. I'm looking forward to the grad walk next week. Wherever you are and wherever you go, your alma mater will be cheering you on. Don't be a stranger to our campus, and remember that even after you graduate, we are here to support you in many, many ways. So now, COVID-19 updates. As we look to the winter and spring, I want to provide some COVID-19 updates for you. The University System of Maryland COVID-19 vaccine requirement will remain in place for winter and spring semesters. This means that all students and all employees must be fully vaccinated against COVID-19 or receive an exemption in order to have access to campus. Those who receive an exemption or are waiting to become fully vaccinated will be required to test twice per week in order to maintain access to campus facilities. The University Health Team is closely monitoring information and news regarding the Omicron variant. This is nationally and worldwide. Currently, our case and positivity rates remain low. This is still the safest place in the county to be. We are certainly remaining vigilant, but I'm encouraged that our high vaccination rates, regular testing, and in-house contact tracing and other safety protocols are continuing to limit the spread of the COVID-19 on campus. Now, I'm going to turn it over to Vicki Lentz, and she will talk about some of the details of our COVID-19 protocol for next year.
Thank you, Dr. Wright. I want to start by encouraging everyone who is eligible to get their booster. That means if you received both doses of Moderna or Pfizer at least 6 months ago, or you received the one-shot J&J at least 2 months ago, you should get your booster. We offer all 3 FDA-approved vaccines right here on campus. You can also get the booster at any location that is convenient for you. Getting a booster is important because, as with most seasonal vaccines, effectiveness may diminish over time and as the virus mutates. For example, some early studies have shown those with a booster may have more resilience against the Omicron variant. As we monitor the spread of the virus and remain committed to doing everything possible to keep the campus as safe as we can, we will be taking some additional steps to protect our students, faculty, staff, and members of the community. All students and employees will be required to get a return test when they come back next year. The timing of this will be different for students and employees, and it will be based on your need to have access to campus. So for faculty and staff, they will need to test on their first day back to work in person, and the students will need to test on their first day back on campus. Additionally, those who are vaccinated but who have not gotten their booster will have to begin to test twice weekly beginning in the spring. If you received the J&J vaccine, you will need to get a booster as soon as you are eligible. If you do not get that booster 90 days from your first shot, you will need to begin testing twice a week in order to maintain access to university facilities. If you received one of the 2 mRNA vaccines, that would be Pfizer and Moderna, you will be required to get your booster no more than 8 months after your second shot. That means you will need to start testing twice a week if more than 8 months have passed since your second shot. I know this is a little confusing, so please make sure you read your email this afternoon for additional details and information. Finally, I want to note that the University Health Team continues to consider the mask policy based on several public health metrics. We expect that we'll still be in masks when we return in January, but if trends continue the way they've been going, we might see relaxed masking protocols in the spring. While masks will continue to be required in the classroom, we anticipate the requirement to be lifted in other areas of campus if our case and positivity rates remain low, among other factors. Another metric in this decision will be the percentage of the campus community who have received boosters.
Thank you, Vicki, and thank you so much for your incredible work to keep our campus safe during this pandemic. As president, I really relish the opportunity to say that this campus is the safest place to be, and you and your team and the University Health Team have been largely responsible for that. When we started this semester, we set out to provide as normal a university experience as we possibly could, knowing that we could only do that if we kept everyone safe. I am so proud of our students who continued to show incredible resilience during these challenging times. Your desire to learn and engage led you to do all the things necessary to keep one another safe and to keep our campus open. Our incredible faculty continued to teach and mentor students, finding ways to help and support those who could not attend class in person, and they maintained the high-quality instruction that our students and others have come to expect from SU. And our amazing and dedicated staff took on new roles and additional work to ensure that our students remained supported and to keep our university functioning at the highest level. We asked so much of you, and you all delivered. This entire university community came together in ways that are difficult to put into words, but I want to tell you how incredibly proud I am to be SU's president. To all of you, faculty, staff, students, and members of our community, thank you. Now I'm going to turn the briefing over to my Chief of Staff, Eli Maudlin, and he will answer the questions that have come in. Eli.
Thank you, Dr. White. I think that you addressed most of the questions, but one of the questions that did come in was about the likelihood of a move to remote learning in the spring. And I think that based on what we heard from Vicki and Dr. White, if things continue along the trend that they're going along and folks are getting vaccinated, getting boosters, then we have no expectation to change the delivery of classes and instruction. Someone asked what they should do if they are unable to get a booster appointment at the time that they want. So please continue to check the website, the SU Vax website, as we continue to add new booster appointments. There are new appointments being added for next week as we speak. As Vicki mentioned, we also encourage folks to get appointments at their local pharmacy or at a pharmacy here in Salisbury or through the Wicomico County Health Department. If you visit vaccines.gov, which is on our website, they show you appointments available all throughout the state of Maryland and throughout the country. If someone is visiting campus, do they need to test? So if you are compliant with the vaccine mandate and Salisbury University has that information, even if you are only coming to campus for 1 or 2 days, you are cleared for campus. You can check your clearance through Gallnet. This question was addressed by Dr. White, but all students and employees will be required to get a return test in the spring semester or when they return to work in January. This person asked if students can be tested if they are feeling symptoms. Absolutely. So you can email or call Campus Health students and employees if they are not feeling well, and Campus Health will schedule you for a test or refer you to Student Health Services if there's an indication that the illness may not be related to COVID-19. The university will continue to offer the boosters and the vaccine to the campus community throughout the spring semester. So when we come back in January, Campus Health will be offering all of the vaccines again to members of the campus community. And I think Vicki addressed the question about masking. Certainly, there will be a number of metrics to consider in the spring, but the university health team will consider the masking policies again. That does it for the questions that came in, and please monitor your email for additional details about the COVID-19 protocols for the spring.